You seen the most natural ones
What,
before?
like the bamboo?
It's like the fur or something.
Yeah,
Like
fur.
that. I don't
Felt, is it?
It felt like
really?
like
Ooh.
animal's fur, but I don't think it's so. I
Are
hope,
you
I
sure
hope
it
not.
was a toothbrush?
I hope not. Oh yeah, maybe I was really wrongly. Well, hello there. Welcome to the next episode of the Bite Angle podcast. You notice that we have a lot of different things today. We have a nice setup. We bought these mics recently, and I'm really enthusiastic about mics now. There's a lot of things to know. I'm going to introduce you to our new doctor, Dr. Bernard. He's here, and today we are talking about, what are we talking about, Bernard?
We're talking about a multitude of things, right?
We got a lot of things planned for you guys.
Yes. But I think we wanted to start off with the simple but very important thing, which is preferences of toothpastes and toothbrushes.
Okay, that's a huge topic. I think you are really, really good at toothpaste and toothbrushes. I personally, I just recommend whatever does the job for me.
Yes.
That's
Now, to start off with that, what does the job for you?
Yes.
Yeah, what do you use?
So I have been using Oral-B for like the last 8 years, and that's
Electric?
like So was it i7?
The IO7.
The IO7. The
Yes,
IO7. And it sounds like a BMW car.
I know, right?
But yeah, it's an IO7, but it recently died on me. And,
Yes.
it's not. It used to be built better, but
Yeah.
I think it's maybe just a user error from my side. So now I'm using the Curaprox.
Oh, okay. And you love the Curaprox, right?
It is good. But
Yes.
I always prefer electric if I can. Do you
Yes.
prefer electric?
Yeah, 100%.
Okay.
Yes.
Like,
So this is the question I get a lot from patients too, which is, doctor, should I use an electric toothbrush or a manual one? And oftentimes, if I look in their mouths and I know that they're using a manual toothbrush, means that they need to use an electric one, right?
Okay.
But I think it's so. Today I was actually asked that question by my patient, which is I said to her, "Are you using electric toothbrush?" And she said, "Oh no. I've always used a manual." And actually, I think people have told me that I should be just using a manual toothbrush because the electric one can be damaging.
Yeah, that's what I hear a lot actually. Like,
Yes.
you're brushing too hard because you're using an electric toothbrush.
Yes. And have you found that to be true?
No, not really.
No, right?
Yeah.
Yes.
I don't know who spreads these rumors though.
I know. And actually, there are some dentists that say it.
It's the manual toothbrush companies that are spreading.
But there's also technique that is involved, right? How to do it. But I think in the old days, when we're talking about old days, like in the 70s and 80s, there are electric toothbrushes. If you've ever been to like a hotel, like a mid-tier hotel, and they give you those toothbrushes, the bristles are super hard.
Yeah. I've also seen like those natural ones. Have you seen the most natural ones
What,
before?
like the bamboo?
It's like the fur or something.
Yeah,
Like
fur.
that. I don't
Felt, is it?
It felt like
really?
like
Ooh.
animal's fur, but I don't think it's so. I
Are
hope,
you
I
sure
hope
it
not.
was a toothbrush?
I hope not. Oh yeah, maybe I was really wrongly. I was like,
Yeah, but no, so she had a lot of plaque and stains in specific areas, right?
Yeah.
And that's the problem. And in some areas, the electric toothbrush just does a much better job because all you have to do is just fit it there. And also, they usually have a smaller head. Right?
Yes, I think that the smaller head, it really does a better job in this sense.
Yes.
But so within the heads, I like the floss action. Are you using the Oral-B actually?
I'm using the Oral-B.
Okay.
Yes,
Okay.
And actually, in my household, we have 6 electric toothbrushes.
Really?
Yeah.
Wow.
So I've tried them all. Used to use the Philips Sonicare.
Okay.
Right? And then we've also got the Curaprox one. I love the Curaprox
The
because
new
it's very
one, right?
simplistic.
Yeah.
And the brush head is small, which is lovely.
Yes. And the bristles are very soft.
Yeah, bristles are soft. Yeah. And then the different levels of Oral-B. So for my both son and daughter, I've got a 14-year-old and a 7-year-old at home. They all use electric toothbrushes, and they're all Oral-Bs. So, but they're different types. Like my son has the Cars one, right?
Yes, okay. I didn't know that. Yep.
And then my daughter has now graduated to like
from Frozen.
Electric from the Frozen to the Oral-B more adulty toothbrush, right? Because but I don't want to get her a super expensive one. So so the bare minimum I would always suggest, and this is what I suggest to my patients too, is like if you've never used an electric toothbrush, it's very daunting to buy even a more than $100 toothbrush, right?
Yeah, I mean that's the big thing, right?
It's costly.
It's costly, and if it spoils, it's really like
Yes, exactly. So go with a low-fi one, with the. But I would say bare minimum a rechargeable one. And just I think Oral-B has a one called Vitality, which is like $30-$40.
But that's a mid-range one? I know the IO is
super low. Super low. So all it does is that you press one button. And then it turns, right? And it's got only that one speed and one function. There's no timer, there's nothing. But it's good. Good enough that it gives you the proper brush, right?
You know what I usually recommend my patients is that they and especially those people who brush too hard, I'll say, hey, get one of those, one with a pressure sensor there. Because that has like a real analysis of how you're brushing.
Yes.
So that's what I usually do. And that usually is the higher tier.
That's right.
Ones,
yes. And yours lights up, doesn't it?
Yeah, mine lights up and things like that.
Mine does too. It's got this like bright red light into my eye. At least the IO ones have like a white light now. It's not.
Yeah.
But the old ones is like this.
I think you really think, you're brushing too hard, that kind of thing. Also, that's what it is.
Yes, but I actually did an experiment. So I experimented to see how hard do I need to brush to hurt my tooth structure, right?
That's
so you press beyond the red light, and see whether you can do it. Because some patients go, I think I'm hurting my gum. But no, you can't. I couldn't
you
do
can
it.
actually, but like it's
you can. But
really,
I think there's
really
multiple factors involved.
In fact, I think to add to that, I think but that's a separate topic altogether. But I think that a lot of gum recession, a lot of gum receding, what we see over in our clinic is due to grinding. It's due to like moving your teeth and you're moving out of the bone space. I think that's a lot more because if you have a lot of bone surrounding a tooth, you can't possibly just brush off the bone.
No, you can't.
It's not possible. So it's like there's other reasons why your gum recedes, not just because you're brushing too hard. I think that's a too simplistic way of putting it that way. And I think so. You have 6. I only have 1. I only have 1 for myself.
Not for myself, by the way. I'm talking about the whole house.
No, but I just changed the heads.
Yeah.
Okay.
Yes.
So you do it as well? Or?
I changed the heads. Yes.
Okay. No, I did change your heads between.
Oh really? No.
So Tiffany and I would change. Okay. You guys have one on each shoulder.
A bit. What happens if all of you need to brush at the same time? Like so let's see. If you go on a holiday, like you've got 2 kids, right? So let's say all 4 of you. You gonna change it?
No. So what I do for holidays is I don't bring the
right.
I just
so you use
manual.
Yeah.
Because I gotta bring the charger, I gotta bring the heads, and I gotta charge something extra. So I mean, you don't need to brush super well for your holidays. So unless you go for a very long holiday.
Yes. I got to a point where I was a little bit almost not obsessive, but curious about how do we rate toothbrushes, right? Yeah. So then you have to have categories of toothbrushes as well. So how I break it down is simple. I think with electric toothbrushes, you have the rotating head one, the oscillating head. And then you have the sonic.
Which is like the vibrating
one. Yeah. But people have to understand that if it's sonic, you can get those manual toothbrushes that have a tiny battery in it and it vibrates very slightly. That doesn't do anything, right? That really doesn't do anything. You need it to be like 40,000 revs.
30,000 revs, is it?
At least 30, I think, Some people actually say close to 40, but
it's really hard to quantify because to us, it just feels like a vibration. Like lower hertz, higher hertz. You don't really.
No,
You can't really tell exactly how much.
But from
hertz,
from the microscopic perspective, you actually see all the disruption of the plaque, right? From the the teeth.
And so like I know you're really good with toothbrushes. Which is the literature showing? How is the literature showing in between ultrasonic, like sonic toothbrushes and like rotating, oscillating, what they call it?
Yes. So the general concept is that oscillating toothbrushes. So oscillating is more that it turns and it goes forwards and backwards.
Yeah.
Right.
Well, yeah.
That has the best.
That's like Oral-B, right?
Yeah, Oral-B. Yeah, the higher level ones.
Okay.
As long as it's not the super basic, it has the oscillating.
So the super basic
brush.
just goes
round.
Okay.
Yeah, not bad still.
Okay.
Still better than manual toothbrushing. So to break down the research that has been done is this: electric toothbrushes far out trumps manual toothbrushing.
Yeah,
right?
they were saying that there was a study that showed there was like 2 minutes of brushing equals to 6 minutes of 2 minutes of manual brushing and 6 minutes of electric brush.
Sorry. Yeah, 2 minutes of electric. Yes,
2 minutes of electric is 6 minutes of manual.
Correct. Yeah. And then if you do that, and you know, okay, electric toothbrushes, then you break it down into which one is really the best. Then it comes down to the oscillating defeats the sonic by a little bit. Right.
Okay.
And they're just looking at like plaque scores, really. Right.
It's hard because it's also like it's super variable, right?
Yes.
Like,
Yes, variable. But I guess you are looking, and so there's no statistical difference.
Yeah.
There is only a little bit of difference, but the consistency is that. So if they get a pool of people, any kind of person to brush, you get them to brush with a manual toothbrush, and then you get them to switch to an electric toothbrush.
Yeah.
And then they use either a sonic or the
oscillating one.
Oscillating one.
Yeah.
And then see whether the plaque scores are very different or they are similar, right? They're similar, but the oscillating seems to do always a little bit better. That's in previous researches anyway.
Yeah, it's quite interesting.
Yeah, and in some ways, I guess it makes sense, but the sonic toothbrush is useful, and from my experience, it's useful only if you put more pressure and in a very it's slightly more technique sensitive. You've got to angle it the same way, almost like a manual toothbrush. And you have to be,
maybe that's why people are more used to it, and that's why you're using it better.
I think so.
Maybe. Yeah.
Maybe.
You should really get the Oral-B guys and the Philips guys to duke it out here.
Yes, true. But you know, they will say their own thing, and have you've spoken to like the reps before, right? About,
I mean, obviously they'll say that toothbrush is the best.
But what really made me switch back from a sonic to the oscillating head toothbrush is basically battery life. I don't know whether you experienced it or not, but the battery life is terrible with sonic.
No, you see, because I charge my thing all the time.
All the time, right?
Because once I brush, I put it in the charger.
Right.
But if you're traveling, then that's a different story. Yeah.
And so we have so many toothbrushes, electric, right? So we've got this whole port system, right? You've got the electric toothbrush.
Man, you should do actually like a review on some of them.
Yes. This actually I have. You know, I used to have a website.
Yeah.
But we kind of discontinued it because it was. I mean, it's how many toothbrushes can you eventually review? But
no, actually, there's a lot of Japanese toothbrushes out there, like
electric ones.
Yeah, I mean, not really electric, but I think the manual ones.
Oh yeah, manual ones. Yes.
Like you go like Donkey, it's like full of like toothbrushes.
Yes. So let's talk a little bit more about the manual toothbrushes because
that's a great idea.
You have certain favorites.
I use a lot of Curaprox because the clinic ties up with Curaprox a lot. But we actually feel for the product.
Yes.
Yeah, they're really good, like soft. They have a lot of bristles.
Yes.
5,460, yes, you remember.
Yeah.
Bristles in that particular head. And so it gets really efficient cleaning.
And it's so pretty.
It is. I think the colors really
sell. Really good. I mean, it's like the iPhone sometimes, you know, you get it for the color.
You're right. You're right.
So, no, it's fun. And I love the Curaprox as well.
Yeah.
The microfilament versus like the regular toothbrush, some of them have bristles that are very, very fine. And if you look at it very carefully, it's almost like very feathery. Have you used those before? And do you like them?
Yeah, I not really
Oh, okay.
like it as well.
Yeah.
I think with toothbrushes as well, sometimes and a lot of patients also say that, right? It's like, I don't feel it's clean enough. You will get it all the time. Like,
Yes.
I brush so hard because I don't feel that it's clean enough.
Yes,
enough
yes.
Unless I brush too hard.
Yes, yes.
Well, with the feathery one, I feel that way as well, I guess.
Yeah. And actually, I've had to do this as well. So when people say I'm brushing too hard, I've been told I'm brushing too hard. It's like impossible to do it with the microfilament ones.
Yeah.
But I noticed that it works really well if you press very, very firmly on it. So the bristles actually slide under the gum.
Yeah, and that's what you want. You want to be
Yes.
slightly below the gums
Yes,
a bit. Yeah.
yes. So I teach my patients to push firmly, and sometimes they don't know how hard is, right?
Yeah.
So I actually get them to come in to the clinic with their manual toothbrush.
Yeah.
Right? And I'll show them the angle and I press and I say, remember this feeling. And they'll be like, ow! And I said, that's the right the right pressure. But you just keep going at it because and it's not to scrub your teeth.
Yeah.
That's it. Your mouth is not the toilet floor. All right. You don't have to scrub and scrub. You actually press firmly, and it's got. Have you heard of the term Parkinsonian movement? It's like your hand is shaking like a vibration.
Oh,
right?
okay. Yeah.
Like you have a tremor. But that's the kind of the action that you want from manual toothbrush. Basically, it's the.
Oh, really? My technique is different though.
Oh, okay. Yeah. Tell us about your technique.
And
Yes.
I don't know whether this is called the modified base. I always remember. So it's like, I'm trying to go circles.
Yeah.
But the problem is that I think that not everybody can go circles well, especially your kids,
Yeah, for sure.
because they can't
Yes.
like that. Like, you want to have like a real turning effect.
Yes.
So that I always teach my patients that.
Yep.
But if for kids, I'll just ask them to go like linear movements. So that's my way of doing it.
Yeah, for sure. And for kids, I guess the most important thing is just to get them into a habit of brushing. their
Yeah,
teeth,
so
right?
that's happening with Julian and Thomas. We're trying to get them to brush. So like a lot of toothpaste.
Are they good?
So
at their
Julian and
brushing?
Thomas are my kids. Yeah, just to let you know.
Yes, I know. But I think the audience maybe not. Yeah.
And so with them, they are just using toothpaste as because they can use the nice toothpaste. That's why they're brushing their teeth. It's not because they're
Right.
brushing.
Okay. So
But mom's a dentist, dad's a dentist, so
I know. My kids are embarrassingly bad with their brushing.
is it?
My son, not so much. My daughter was okay. This is a funny story because I once caught her not brushing her teeth, right? Especially at night. And so I said, I didn't hear that you were brushing your teeth. They use electric toothbrush, so you hear the noise, right?
Yeah.
And so then she said, oh, okay. Then next night, I caught her with the electric toothbrush on the sink, not in her mouth. She's
And
just
it's just
standing
great.
there
Oh.
looking in the mirror. I don't know doing what, but so that I would hear and think that she's brushing her teeth. This is how lazy she is, right? Lexi, if you're hearing this, right? And so I have to actually be there and watch her brush her teeth.
Oh wow, okay.
Because she would actually just turn it on and leave it.
Actually, right, they should have an app for it. Having an app, and then you brush your teeth, and then the toothbrush just say, "Hey, look, your son brushed your teeth."
Oh dear.
Okay, I know it's a lazy parenting.
No, but I think that would be that would be good for you. I think because you love this kind of stuff.
Yeah, I love gadgets. Yeah,
You have the IO7. So to tell the audience, the IO7 electric toothbrush has a screen on it. And it would tell you after brushing for 2 minutes, right? It'll give you a smiley face.
Yeah.
Right? And I thought, what kind of rubbish is this, right? I don't care what face you give me. But I gave this toothbrush to my wife, and she goes, "Oh, look, it gave me a smiley face. I feel so happy now."
So let's talk about. I want to talk about charcoal toothbrush.
Oh yes, yes.
Because that's a big thing for a lot of patients. They say, and it's a big thing on the supermarkets. You always see like these black bristles and things like that. And
yeah,
it's a big market. What do you think of that?
I don't care for it.
Okay.
How about you? You think it's good?
I think that I don't think it's good.
Yeah.
I don't think it's good. But like it's a big market. So,
Yeah.
so I'm just worried that it's a bit too abrasive. Like that's what I'm worried about, right?
Yes, yeah. So negative net net negative effect, you think, right?
Yes.
Okay.
But I guess the benefit of using a charcoal toothpaste would be to whiten teeth, but it's a detrimental effect because it actually makes the teeth like you just abrade the teeth. That's why it looks whiter, right?
Yeah. So it's short-term gain, long-term loss, right?
Yeah,
Because
yeah.
if you lose more of enamel, your dentine, which is a darker color and cannot be whitened, will actually eventually be exposed, right?
Yeah.
So
And then
it's,
that's a big problem.
yeah.
Okay, so
And you get more scratchy surfaces on the enamel as well.
the thing is that at one point the tooth is gonna look yellow, right?
Yeah,
Because you will
for
go
sure.
into the dentine, which is like quite intense. Like you're really brushing quite intense. But I've seen a lot. I literally seen a patient that has I don't know where I still have the photo, but it was like they are like like one of those mountains when you go in and there's like lines and streaks of like water streaks and erosion.
I've seen that before too.
But yeah, it's like carved out, man. And I was like, whoa, that sounds
And manual
intense.
toothbrusher.
Yeah.
Yeah.
And I think the bristles are like
Hardcore.
made of like steel.
must be from those hotels I was talking about earlier.
yeah, I think so.
Yeah, so no, I'm not a fan of charcoal.
What about charcoal toothpaste? Is it the same thing for you?
Yeah.
Okay.
Yeah.
So same abrasion issue.
Yes, yeah. Oh, so that segues us into a discussion of something that people may or may not know, but some nerdy people have actually come up with the relative dentine abrasivity index, the RDA index, right? You familiar with that? Yeah, right.
Is it a big thing now? Like I've not.
I actually give out a chart to some of my patients.
Okay.
To know what to watch out for as far as what toothpastes to go for, because some of them will give an RDA index. But a lot of it has been tested. So I think it should be in the long term something that should be recorded on the label of a toothpaste, don't you think?
I mean, but it's hard to read it as well. Like, like who actually knows what's an RDA?
Yeah.
Right? I mean, like, unless you're like a nerd like us, like you actually like look at all that stuff and like,
exactly. But then I guess it's up to the dental professionals to talk to our patients about to explain.
And okay, let's maybe just talk more about RDA. So what's the recommended RDA and how does that work?
So RDA, when they say relative dentine abrasivity, what it means is that if let's say you have dentine, which is a softer part of your tooth,
and the inner part of the tooth.
Yeah, inner part of the tooth. It's part of the root. And why they use that as the guide, because the enamel is so hard that the abrasion on the enamel is a bit harder to record, right? So if let's say you get the weaker part of the tooth that might be exposed in your mouth and you're brushing with a specific type of abrasive paste, they are trying to compare one abrasivity to another toothpaste. So that's why they call it the relative abrasivity index, because it's something that is
there's a control versus something.
Yeah,
yes,
it's not a quantification of anything.
Yeah.
It just gives you a guide, right?
Yeah.
And so the general thing is that so water is like 50. Okay, so let's say no abrasion whatsoever is as low as under 50. Okay, it's not zero, but if you go up to about 100, it is basically a very low and safe
and
abrasivity.
that's sort of what you want in a toothpaste.
Yes, yeah. It depends, I guess, because then you get slightly more abrasive toothpaste, but not harmful. which is about 100 to 150, but they say try not to exceed 150 with the RDA index. But it is a bit arbitrary, right? So hard for you to know. But you can't tell as a person that you rub the toothpaste in your fingers.
RDA.
Yeah. Maybe some savant can do it. But I don't think your teeth will really feel it either. But it's the coarseness of it, right?
Yeah.
Yeah, and I guess it also depends on the what they include, like the toothpaste companies, what they include in the. I think Colgate uses microbeads or something, and actually a lot of
it's quite a lot of different things as well. That
yes.
Hydroxyapatite has the spherical one, the non-spherical one, as well. So I think that's a big thing as well.
Exactly.
And what do you think about herbal toothpaste? That's something that I've.
Yeah, I don't care for it. Again, but. Okay, so
it sells. In the market. It sells a lot
sells
because it's like organic, things like that. I think that's a big thing for patients.
And I find it hilarious when they say natural toothpaste, because nothing is natural that is in the toothpaste, right?
I mean, it's processed. There's definitely some
of course, something
processing.
processed. Yes, exactly.
Yeah,
it's not like you pluck a tube of toothpaste from a tree. Right, that is natural. Right? Yeah. So it's not naturally occurring, and some people go, okay. So I think the bigger contention sometimes is the use of fluoride, right? And now people are going, okay, I'm very anti-fluoride. So you get these two factions now: anti-fluoride and very pro-fluoride as well. And I guess a lot of people still don't care very much, and they follow the professionals by saying. If the professionals say, oh yes, fluoride is good for you, then they believe it, right? There is a nuance to toothpaste, but I still believe in fluoride toothpaste. The difference is that fluoride comes in many different forms, right?
Okay.
And when I think people are mistaking fluoride and the different forms of fluoride and the different forms that we are absorbing fluoride that is useful for us to have less decay.
Okay, yeah.
Yeah.
If you're talking about fluoride, that's a big controversial topic. Yeah.
We can talk for hours on
Yes,
this.
it is.
Yes.
Okay.
Maybe for some people, it's like the most dull, boring, dry topic.
Well, for me in dental school, I slept quite a bit. I was like, okay, basically fluoride was good. But and then you have the different things about fluoride and how it works out. But actually, it's really important. And don't get me wrong, I studied it, but still, it was boring because you especially the chemistry part of it. I was like, oh man, the formula and how does it make fluoride-apatite, and all that stuff.
Yes. So to break it down for the lay person, okay, we have to ask ourselves, why are we using a toothpaste? Okay, so we used to think that the toothpaste is like a soap, that it's to wash your mouth of germs. Right?
Yeah.
And now, actually, I think that is considered harmful. Harmful in a way that you're not supposed to have the disruption of all your microbiome in your mouth. And it's not necessarily 100%, it's still better than nothing, but it's not the most effective way to do it in the long term. Because one of the other questions that we have to ask ourselves is like, if fluoride is the best thing ever, and this is one of the arguments, is like fluoride is the best thing ever, we get this toothpaste, everybody's using these toothpastes now.
Why is there decay?
Yes, why are we still getting decay? And the answer is that our sugar intake, right, is very high. So that's the other equation as well. So we have to look at, okay, our teeth are breaking down very, very slowly from just function, right? You have acid, and we know for sure they're at a certain pH level. So let's say you drank an orange juice, right? And the pH of the orange juice is 3.5. And that is under the threshold of 5.5. So anything of pH under 5.5, okay, so 7 pH is neutral. Yeah. pH 5.5 is actually
slightly acidic.
pH very slightly acidic. It's actually acid rain is pH 5.5.
Yeah.
All right. But anything more acidic than that, actually the enamel structure melts, like literally dissolves from from a solid form to a liquid form, right? But when you have fluoride in that area, what we found is that when the pH goes up above 5.5, the mineral actually reforms. Like think of it like a block of ice, right? And if you take it out of the freezer, when it reaches that threshold temperature, it melts, right? But you still have the same molecules there. And then you put that water or melting ice back into the freezer, and it gets hard again. That's exactly what happens to our teeth.
And gets stronger,
yes.
sort of.
Yeah. So the thing is, we need to consider with toothpaste a remineralizing agent. So because even if, let's say, the block of ice came out, and the ice melted again, right? So it's like your tooth, you lose some mineral, but that mineral was not replaced. If you then put it back into a condition where it's now neutral, like let's say you sleep at night and then your saliva just made it all neutral, but you have no mineral there, you have less mineral there than what was before, it will not reform again.
And therefore you have a sort of
eventually a deficit. Yeah. And eventually becomes a hole.
Right.
Yeah, exactly. So that happens over a long period of time. So the problem is
like
that
a chemistry reaction every day.
Exactly. So the thing is, when you look at natural toothpaste, if they don't have any remineralizing agent that's in it, so calcium or phosphate or like a fluoride, then you will find that the tooth will still diminish in its structure over time.
And I think the worst case scenario would be if that toothpaste was acidic as well.
Yes,
then you'd be like, oh man, I'm losing double time. Yeah.
Are there any acidic toothpaste? I hope not.
I know there's a lot of acidic mouth rinse.
Yes, that's true.
Yeah. And also...
And sometimes even bottled water is acidic. They actually found that.
I didn't know that.
Yeah. Someone actually tested. I won't name the bottled water company, but there was someone that actually used litmus paper in
and they tested. I mean, like,
and it was pH 4.5.
But some people are. That's why they are also promoting like alkaline water for other benefits.
Yes,
as well,
yes, for sure. Yes. And okay, so on that note, what do you think about alkaline water?
To be honest, I think man has lived long enough without alkaline water and it's been okay. So I don't really see a significant benefit of it, but I might not be an expert on it, I guess. Yeah.
And okay, so this is the other thing that I was curious enough to actually go down the rabbit hole about alkaline water.
Why? Is it because your wife wanted to buy a...
No. Actually, it was me.
Some system,
No. It was me, and she thought I was crazy, right?
Okay, cool. I would like to hear more. Yeah.
Yes. So, okay, it's nuanced as well. Yeah. So, alkaline water, if it's oxidized water, so it makes it a little bit more alkaline, but it's not the alkalinity that is what will save your mouth from problems. So, I'll give you a practical scenario, right? If you drink alkaline water, I mean, I didn't see any benefit for myself, really.
Okay.
But if you drink alkaline water, some biochemists actually say it can be very harmful because, people talk about alkalinity is good for your body, right? Alkalizing effects. Actually, alkalizing things are acidic. So again, we are being very nerdy and chemistry-ish about it. Yeah. But why is lemon alkalizing? It's alkalizing because it's actually very acidic. So
and it takes away the hydroxy.
That's right. Yeah.
Groups.
But what? Yeah, exactly. So what happens is that when you consume something that is acidic, it alkalizes because your system has to alkalize your blood, right? To neutralize the ability, right?
I'm just hoping that we're all correct on this.
Yeah. So it's not from me, by the way.
Okay.
So it was, it's not my own theory. Okay. Well, okay. So I break it down very easily for patients, which is that I'm not in the science of being a nutritionist, all right, or
Although one of our colleagues is a nutritionist.
Oh yeah, great. I mean that
Leanne
is
is a nutritionist. She studied.
yes,
nutrition,
yes. No, it's very useful.
Yeah, yeah.
Because
you should bring her. Yeah,
because we forget that the mouth is actually part of our
it's like the portal.
gastrointestinal system,
Yeah,
right?
it is.
So we consume food through there. But all I'm interested in is if, let's say, my focus is that you don't break down your tooth structure, your hard tissue, right? That's my number one goal as your dentist.
Yeah.
So all I care about is what is acidic in your mouth.
Yeah, and what are causal factors and how we can try to
Exactly.
treat those
Yes.
as well. Yeah.
And so what causes alkalizing or alkalinity or acidity in your blood to make you healthier? It's not to do with how alkaline your water is. Because apparently this is what the biochemists have talked about. And I can't quote exactly who said this now from out of memory. But basically they're talking about you want your water to be relatively neutral, but it can be within specific realm of the pH. Because actually a lot of poisons are at a high pH level.
More
right?
alkaline.
Yeah,
Okay.
more on the high than the lower pH.
Okay.
Right? But the pH, our saliva, so to give everybody an idea, is that our pH level is on average about 6.4. It's not absolutely neutral because we need a bit of acidity for the enzymes to work in a very specific way. Yeah, so I don't think we need to mess with nature too much, right?
Yeah.
But at the same time, you don't
You can
want
biohack if you can.
Yes, biohack. But you don't want to so all I'm interested in is how long is my patient having this acid in the mouth for long periods of time. Short periods is okay. So let's say your nutritionist would tell you drink a glass of lemon juice in the morning, right?
Yeah.
Because it's kind of it helps you with your system to detoxify, right? So I'm not gonna to argue about any of that. The concern I have is that I don't want that lemon juice to sit in the mouth for long periods of time, because if you're drinking it and then you just leave it and you don't have anything, it's going to damage your teeth over a long period of time.
Yeah.
Right? You don't see the damage immediately. But if so I say to my patients, immediately after that, just sip a bit of water, swirl it in your mouth, and then neutralize the acid.
Yeah. Or just use tap water.
Yeah, tap water is fine.
Really good. Yeah.
Tap water is actually quite alkaline.
Yeah. And it's fluoride
in Singapore,
in some
yes.
areas.
Yes, exactly. Yeah. So but that's about it. And so talking about toothpaste, yes, I going back to herbal toothpaste. Okay, so the other thing is that do your patients talk to you about toothpaste a lot?
They don't really actually.
Oh, okay.
They don't really, but they always ask for my recommendation, and I'll just tell them, hey, look, you need to look for something like a 1,000 ppm. Sort of fluoride concentration that we're looking at. Things like that. And to be honest with you, as long as the RDA, the toothpaste RDA is it's variable, lower, and it's not abrasive, I'm pretty happy to.
Sure.
Actually, I mean, toothpaste is also just one part of the puzzle, right? And you need to brush well.
Oh yeah, for
techniques
sure.
are well, things like that.
Diet's gonna be good.
Yeah, because like if you
lifestyle.
just some people get caught up and say, hey, I need the best toothpaste, but if you don't brush your teeth really well, that doesn't really matter anyway.
I agree.
So it's a whole entire it's a multifactorial thing.
Yes, for sure.
Yeah.
So the one thing I do say is that if a patient comes to me, and I'm curious usually of what toothpaste they use, and I tend to record it in their notes, because sometimes when they change something happens in the mouth. It's very strange that way, right? So giving you an idea, so one patient started to get ulcers in the mouth because of her changing the toothpaste, and then I got her to move on to another toothpaste, and then she was fine again.
That's strange because I also get that. When I have some toothpaste, especially minty ones.
Yes,
I get my lips just
peel.
There's a lot of peel.
Right.
There's a lot of pain and dry lips.
Yep.
But then so I'm sticking to Hydroprox ones, and they are pretty okay.
Okay, great.
Yeah.
Yes, another plug for Hydroprox.
Yeah.
No, they're well researched as well.
And
right?
that's why when I go to like holidays, toothbrushes, I'm still like, for me, I'm okay because I'm only gonna do that for like maybe like a couple of days. But the toothpaste, I'm like, no, I gotta use my own toothpaste.
Yes, yeah, for sure. We bring our own toothpaste every day.
Yeah. That's a big thing for me.
Yeah. Actually, toothbrushes too. We pack all 4 of our electric toothbrushes.
Toiletries must be a huge bag.
Yes, it is big. Yes. So let's say I ask a patient, what kind of toothpaste are you using?
Yeah.
And their mouth completely healthy, right? Very, very good health. And they say, I'm using a herbal toothpaste. Doctor, do you think I should change it? I'm like, no. Just do exactly what you're doing already.
Yeah, no, agree.
Yeah. Then I usually would ask them, I would explain if they actually want an explanation, like, but some people say, I should have a fluoride. I said, some people will need
like
even sometimes
more help, right?
Yeah, even a greater amount of fluoride for themselves. Because of all the other extenuating factors, But for you, obviously, you've got a good diet. Your lifestyle is very good. Your saliva flow is fine. You're not on very specific problems. With
to be honest, like they can choose any other toothpaste, and it's going to be fine as well. So.
Yeah. I have some people that brush once a day, and their teeth look fantastic.
Yeah. There are some studies that show that actually you don't need to brush for. Was it 3 days? 2 days? There was a big study.
Yeah.
They did it on dental students. I remember this because I was like, okay, not so bad.
Yes, we had to do that study too.
Oh, did you?
Yeah, on ourselves.
So like they actually okay, don't brush your teeth for like 2 or 3 days. I can't remember exactly how long. I think it was 2 days at least. Anyway, so then they check for any like gum problems, things like that, and they could. The gums wasn't swollen. For that time period.
No.
So they say, hey, everybody's like, hey, this is a good time to at least. But then twice a day because not everybody can sort of cover those areas as thoroughly, I guess.
Yes, and your breath is not going to be great after after 2-3 days.
Yes.
And the other thing is, do you brush your tongue? Do you scrape?
Yes, I do. I do.
So do I too. And it was something that I actually learned really late in life.
I mean,
even in dental school, I didn't really do
Nobody
it.
really talks about it in dental school.
No.
Except hairy tongue, hairy tongue. That's
yes.
Where your biofilm on your tongue gets really, really nasty.
Gross. Nasty. And, okay, fun fact, people, 70% of all plaque in the mouth is actually on the tongue. Yes.
Because it's so...
Yes, it's like a sponge, right?
And it's like a lot of surface area. It's like an intestine, right? So that's why you have like a lot more surface area compared to like your teeth. Yeah, and it's interesting.
So scrape your tongue. Now, are you a person that leaves toothpaste in the mouth after brushing, or do you rinse off?
I rinse off. I know what's the standard. I just can't stand toothpaste in my mouth.
Yeah, okay. And again, if it has not caused any decay problems for you, then it's fine, yes. My general ideal practice is to not...
Keep it in? Okay.
Not rinse off.
Yes.
So I treat toothpaste like a moisturizer, not a soap.
Yeah. So wait, talking about that.
Yeah.
Have you tried the gel ones before? Do you like the gel ones? No.
Tell me more.
It's just I'm born with a certain toothpaste.
Okay.
Like I like the foam and things like that. But there's some toothpaste that doesn't have foam at all.
Yes,
and it's just like applying like that's why when you say like about moisturizer, I'm like, okay, that sounds like a moisturizer to me.
Yeah.
Because that's like a gel and it doesn't foam up at all. It just layers.
Yes.
And I'm like, what do you think of that? You like that?
Yes.
Okay.
So
especially if you leave the toothpaste in.
Yes.
Right? Yeah.
Because some people are actually sensitive to sodium lauryl sulfate.
SLS.
The detergent agent, SLS. And and that
is a major thing.
Yes,
it's
a major thing. And it causes the foaming, right?
Yes.
Also. But I've spoken to some toothpaste companies and go, why are you still having this while that people...
It's just a feeling of being clean.
Yes.
It's a psychological thing.
Exactly.
Yeah.
It is.
Same as me because I'm like, I need the foam to...
Yes, because you grew up with it. Yes.
And then like and a bit of the minty as well. Even though I'm like, too strong mint, I can't do it, but... Yes. Like then you need to have the sense of freshness, even though you don't brush it.
You know the funniest thing that some patients actually say is that when I give them something, when they use a toothpaste that is of a different flavor compared to mint, like a peachy one or
Yeah.
I think Curaprox is a gin and tonic one, right?
Yes. But when you brush with like those really really sweet toothpaste,
Yes.
it's sort of like a
It's
sin.
weird.
It's a sin, but you're like, oh, it's not a sin.
Yes,
You know what I
yes,
mean?
yes. And they go, oh, this doesn't have fluoride in it. And people now think fluoride and mint is the same thing, right? But
Do
it's
they?
not.
I don't know that. I didn't know
I get patients that say that. It's like, this doesn't have so much fluoride because it's not that minty. Then it's like, no. Mint is completely different. Mint is actually used because fluoride is actually quite bitter. It's not a nice taste. So they use mint as a...
Have you tasted fluoride before? No, you.
Yes. We actually had a professor that made us taste like just the fluoride.
The fluoride tablets thing.
Yeah, it's just like
have.
the
So,
the
for the viewers
pure
out there,
powder. Yeah.
It's back in Australia. Not everywhere is fluoridated, right?
Yeah,
Like,
and Europe too. Europe, they
and
have
they have
fluoride
like
tablets.
big water tanks. And if you want to fluoride the water, you got to put those tablets in and let it dissolve and things like that too.
Yes.
Of a certain concentration, things like that. So
Yeah.
I think we're gonna have a lot of views this time for our YouTube podcast because fluoride is a huge topic.
Fluoride is a huge topic, and I think it is debatable. So it's something now that we have to, at least as dental professionals, we have to know about it. And have to have a specific viewpoint. So how I actually have this viewpoint now is in 2014, I had a patient. Shout out to Jamie. He's no longer in Singapore, but he was a patient of mine, and he was adamant that he could not have any fluoride in his stuff.
Okay.
Right. He filters it out of his water.
And thus began your journey.
Thus began my journey because we had a debate in the office, a friendly debate. But he said, Bernie, you gotta update yourself, man. You're behind the time. So and it says you have been indoctrinated by.
Okay, I think that has played a part as well.
Yes.
Because every dental student came from a dental school and they have like, fluoride is great.
Yes.
Although I came from a school that is very pro Tooth Mousse.
Yeah.
Because Melbourne is the one who created Tooth Mousse, like the university.
Oh, yeah.
So it's for Tooth Mousse, everyone out there, Tooth Mousse is basically it's calcium amorphous calcium phosphate, which basically means that it's found in is a derivative of milk, which is KC. And then they put it together and they use it as well, and that helps to remineralize your teeth as well. So
fantastic product.
And they have a lot of flavors. I just spoke to the guys at GC, the creators of Tooth Mousse, and they have now they have strawberry, right? They have strawberry. They have, was it peach? No, was it strawberry?
They have melon as well.
Melon.
They have mint. They have mint.
They have milkshake.
Oh, they have milkshake. Okay,
and they have chocolate. They're coming out with chocolate.
Oh gosh.
Which is, we're gonna like sell a lot. And so that's what I recommend sometimes to patients who are for younger patients who are like, I don't like toothpaste, the taste is not good, or there's some issues. Then I say you just brush with, like, Tooth Mousse, or eat. Some kids have really bad caries, and say, hey, just put some Tooth Mousse on, and you like it. It's like yogurt.
Safe. It's safe to take the Tooth
and eat
Mousse
and everything because it's like milk derivative, right?
Exactly. It's that is a natural ingredient, right? Also, and there is no toxic effect as compared to the one thing we have to say is that if you, let's say, a young child swallowed a whole tube of toothpaste, yes, they can get sick from it. Yes, right.
And their teeth might not be so good.
Yes, their teeth. If they do that every day,
then
they'll get something called fluorosis, which we want to avoid. But that one is actually more to do with the fluoride in the water. And excuse me, sorry, I just choked on myself.
No worries.
Excuse me,
but
guys.
I do give a lot of Tooth Mousse, and Tooth Mousse have been helping my patients a lot. Of note that Tooth Mousse, the chemical for, I mean not chemical, but I guess it is a chemical, I guess. But ACP, I guess, CCP.
Yeah, that's right.
That can also be found in a lot of sweets in Japan.
Yes.
Haichu is also having, I'm not sure really Haichu, but there's a certain brand of sweets in Japan, like chewable sweets that have all these things. So it's actually good for your teeth.
Yeah, Recaldent, right? Chewing gum. Yes. Recaldent is calcium phosphate.
Yeah, I remember that now.
Yeah,
it's been a while.
Recaldent, yeah.
And unfortunately, you can get it in Singapore.
Yes. Yeah. Okay, I don't know who's listening to this, but
there are other ways to get your Tooth Mousse.
Yes. You can get chewing gum. But yes. So yeah, Recaldent is very useful because again, it's just having copious amounts of that mineral so that your teeth can absorb it.
And if they break down, they can
exactly, and it takes time for it to absorb. So the problem we know is that, and this is true, is that if you brush your teeth very well for 2 minutes with a fluoride toothpaste and you rinse it out really thoroughly, that 2 minutes of fluoride exposure is almost negligible. Like it's not going to do any great
It's only
effect.
2 minutes of exposure, that's right.
Yeah, that's right. You need a long time exposure.
So I think for a lot of them out there, it's actually the brushing technique that is what is helping been helping them all the time.
Yes.
But if you could leave the toothpaste there, maybe I should.
Yes. But you can slowly. I mean, so Tooth Mousse is great because the texture is much nicer. It's smooth.
Yeah.
It's not as pasty, right? And then you have that taste in your mouth. So I often would say to my patients, get a toothpaste that you do enjoy the taste of because you would want that taste in your mouth.
No, absolutely
for long periods of time, right? And by all means, I'm not saying keep the whole amount of toothpaste in your mouth. Okay, so the other thing that is very important for people to know is how much toothpaste should you put on?
They always say pea-size shape.
Yeah, pea-size. Okay. Yeah. Is it big green pea or small green pea, right? Yeah. I actually asked a biochemist to quantify for me exactly how much. 1 gram of toothpaste is the effective dose.
Is that a big size pea or
two
how
small
big?
green peas or 1 large green pea? Okay,
maybe corn kernels, like corn.
Oh, jeez, yeah, a corn kernel. A corn kernel is a big green pea size amount.
Okay.
Yes, that's a good one. Yes, okay. Yeah, you better patent that,
I didn't know that.
Justin.
Okay.
Corn kernel size.
Corn kernel size.
It's a bit of a mouthful.
Because I think pea size, maybe like in Singapore, you hardly eat peas as much as corn.
That is true.
So maybe in America,
it's a very
like
cultural
Western
thing. Yes.
More peas, I guess, but yeah.
Yeah.
I didn't think of that actually. Yeah.
Yes.
Okay.
You're finding like gummy bear size things.
Yeah.
Yes. Yeah.
That's true. Okay.
Yes. So that's. Oh yeah. Okay. So we're still on the topic of toothpaste because there is also, like you brought up, the Recaldent CPP ACP.
Yes.
Yeah. It's a mouthful, I know.
Yes.
And then the other one is hydroxyapatite. Right? So you mentioned
that's
that
your pet topic. Yes, you like this topic a lot.
Yes. It's my pet topic only because, and I found this by accident, really, by a patient of mine that had very bad decay problems. And I actually gave her the advice of just keep toothpaste in your mouth, right? And she had these decay lesions that were close to becoming cavities.
Mm-hmm. So just about there.
Yeah, about there.
Yeah.
And I didn't want to restore them yet, right?
Yeah.
So I said, okay, let's try this. Let's try to stop the decay from getting worse.
Yeah.
And in her situation, it would be so bad that if it was 1 year later, she would often have a very large cavity that we would need to fill, almost to the point where she needs a root canal. Okay, so we were concerned and we were watching her quite closely. Then she went away for more than 6 months, and she came back, and I thought, oh no, she's probably going to have larger holes now in her teeth.
Yeah.
And lo and behold, her teeth had reversed decay problems. Not only arrested, but the lesions were hard, like they were healthy tooth structure again. And I've never seen that before with a patient with this kind of effect. So I asked her what toothpaste she used. And she goes, oh, it's just a toothpaste I got from work. But what I didn't know about her was that she worked for a cosmetic company that sold a very specific type of toothpaste. And at that time, she's German. And so it's this toothpaste called Carex. And it's not available in Singapore. So she got it from her workplace when she was in Germany. And she's been using that because it was free for her or something like that. So great.
Okay.
And I thought...
And that has a certain...
Yeah. So I had to find out what it was. And it had hydroxyapatite in it.
Okay.
And I thought, oh, that's interesting. So I spoke to the biochemist that created... This is another biochemist. But he...
You have a lot of biochemists.
Yes. No, they're not friends, but yeah, I'm always curious about what they do. So then he said, yeah, we've been researching it since 2008. And then they created the product.
Yeah.
So I was so curious that I started using it myself. And
you did a paper on it before, right?
I did a paper,
like
for them, yes.
Yeah.
As well, and did some write-ups, and it got me down the path. So this came at a very similar time with that discussion of fluoride being bad. So my concern was, when I was writing this, was that, are there any safe and good alternatives? Yeah, and so then Tooth Mousse has been around, and that's been useful, but they've not had a CPP ACP toothpaste.
Yeah,
but
you're
more
right,
so
actually,
Okay. And they are actually quite expensive.
And also, I think the expiry is not so long as well. Yeah.
Yes. And so my quest was, how do I get to my patients to the most basic but ideal practice? If they can do this twice a day, and it's very safe for them to do, then why not everybody does it, right?
Yeah.
So it's the same thing like healthy eating. You don't have to be extreme. You don't have to go on very, very specific keto diets or anything like that. But you just be very moderated and know that if you just keep down this path, your teeth will be fine. And so she was a perfect example that even that she thought she was born with bad teeth, it wasn't that. It was a chemistry
thing. It's all about
imbalance.
chemistry. Yeah.
Yeah.
Absolutely right.
Yeah. And so just by her leaving that toothpaste on, and she wasn't doing anything special. We didn't have to give her expensive treatments or anything like that. And she reversed it. Yeah.
Yeah, I mean, like, I had a patient as well. Same thing. She had a lot of decay, but she wanted to do Invisalign, and I'm like, okay, let's fix all your decay first, things like that. But every year or so, when I saw before the Invisalign, I was just doing new fillings because it was just like it keeps on breaking down, and something is happening to the teeth, or the quality of the teeth is not good, right?
Yeah.
And so what we did for her was, since you're gonna do Invisalign and we fixed all the decay already, why don't you just put Tooth Mousse on your aligners, right?
Aligners, yeah.
And you just put it on and you just do it for the 1 or 2 years when you're wearing the Invisalign. And then let's see how that goes, because at least it's helping your teeth out, right?
Yep.
And she's like, oh, really? It's gonna be very expensive or like laborious, things like that. But she actually liked it in the end because like it's very tasty. So she puts it on, and nowadays when I see her, it's like her teeth has not been decaying for the longest time, and I attributed it to because her teeth are just strengthened from the Invisalign process, from obviously from the Tooth Mousse, so it's a lot better now, and which is really interesting. So you can actually
very
reverse.
interesting.
You know, some people say I'm born with weaker teeth, and we know it's not true. But some of them say, "Hey, I don't have enough calcium."
Yes.
Right. You always say that, right? And so I think if you can try to change the quality of the enamel or the tooth, it's going to be really
and it
helpful.
can be changed. It can be. Yes. And did you realize the texture of a tooth was
shinier?
Yeah, shinier, smoother, right?
Yeah.
Yes.
It's not like porous.
Yes.
Yeah. And it doesn't stain as much.
Yes.
As well.
And actually the most interesting thing that I've ever experienced with a patient was this one guy who was a swimmer. And he would spend 1 to 2 hours in the pool swimming every day. And I noticed, actually post-COVID, strangely enough, he said he used to be a swimmer before, maybe swam more after that as well, because you couldn't do anything but do things by yourself.
Yeah.
And so he said that, what I noticed in his tooth structure was that it became corally dry. And they were breaking down like I've never seen it before.
It's like
mottling, yes.
It's
and
like
they were
dots.
staining really badly.
Yeah.
and he didn't know this, but we knew theoretically that a pH in a pool is roughly about 3.3.
Yeah, so chlorine mostly.
Chlorine, yes, the chlorine, and it's very caustic to the teeth.
Yeah.
So interestingly enough, we tried a few different things for him. One, I got him to just leave fluoride toothpaste on, all right, and brush before and brush after his swims. Didn't work. For whatever reason, the fluoride wasn't absorbed well for him. And then we used Tooth Mousse on him. It worked a little bit, but not great. And then I got him on Hydroxyapatite, and it worked.
Okay.
And so, again, I went to the biochemist and said, I don't get it. Right? They're all, theoretically and technically, the fluoride is supposed to be able to harden your enamel structure, right? This is what we learned.
Yes.
Fluorapatite, when it's created from the fluoride into your crystal structure of your tooth, makes it even more resistant to acid damage than the original structure, the hydroxyapatite system.
Yeah, right.
Yes. But he said what their research have shown is that fluoride works inconsistently in different people's teeth. So
we're gonna learn that.
I didn't know this either.
Yeah, I thought it was just a uniform thing.
Yes. Yeah. So you can use a fluoride toothpaste and it will work wonders. And I can use it and it doesn't work as much. But hydroxyapatite is very, very homogeneous. So because it's the exact same crystal structure as your enamel, it will be homogeneously added onto your tooth within its structure. So it just fills in the blanks.
Oh, cool.
I guess the only way to explain it really, and CPP ACP also works Similarish, but not great because apparently there's more calcium sometimes than phosphate. I'm told because of because it's derivative of cow's milk. Right?
And also it reduces the pH. Increases the pH a lot.
Oh, it increases the pH a lot. Right. Yeah. Okay. So then that was it. Because theoretically, I always thought CPP ACP would do better.
Yeah, that's what I thought.
Than hydroxyapatite, but it seems to be, if not on par, but a little bit better. But we can only say in public, right? This is part. Yes, that actually all three are as effective as each other, and they are theoretically they are.
Don't get into trouble for this.
No. No, I think this is something that is very, very balanced because I actually would suggest to all my patients to use all three in one form or in another. If it's not broken, don't fix it. Right? If you use a fluoride toothpaste, fine.
Yeah, and to be honest with you, Tooth Mousse is used other times other than brushing your teeth, right?
Absolutely.
So there are different coverages at different times.
Yes, exactly. Yes.
So
So all useful, and they all trump. It's like the electric toothbrush is way better than the manual. Remineralizing toothpastes, whether it's fluoride or hydroxyapatite or calcium phosphate, okay, whatever form of these remineralizing agents work better than just a purely fluoride-free natural toothpaste.
Yeah, okay.
Yeah, that makes sense. So it's these two categories that I have to worry about. So when I ask my patients to look at the labels for their toothpaste, if they don't want a fluoride toothpaste, then look for the other remineralizing agent. But don't go with a non-remineralizing agent toothpaste.
Yeah.
That makes sense.
No, totally agree.
Yeah,
I would need to have fluoride in the toothpaste at least or HA.
Yes. I mean, we are people in the know, so and I do this for my whole family. So it's I wouldn't want to poison them. If people go a little bit too far with the poison thing. Yeah. So like everything, you don't want to take medicine that you don't need to. But at the same time, do what works for you, but it has to work.
Yes.
That's the important thing.
Yeah.
Yeah.
Okay.
Cool.
All right. I think that's all for today. Thank you so much for
no worries.
The kind insights, Dr. Bernard. I'll see you guys next on our next podcast. Thank you so much.
Okay.
See you guys.